My name is Kelvin Calera, and this is Nursing Foundation 2, Lab Assessment number 1. Staple removal, dressing change, and DARP. Now, before you do any procedure, your first step is hand hygiene. And if your hands are visibly soiled, might want to wash it with soap and water. And once your hands are dry, it's time to verify the physician's order, which is do not change dressing until POD number 2. Then cleanse incision with 0.9% sodium chloride every 2 days and PRN. And remove alternate staples on day 14 and apply Steri-Strips. Cover with sterile 4x4 gauze and remove remaining staples on day 15, which is today. So that's what we're gonna do. And after that, you wanna verify the patient's information. You wanna start with the allergies. Mr. Tom, my patient here, is allergic to penicillin. And you want to verify the patient's information by matching the information in the patient's band and the physician's order. So make sure they have the same name, Thomas Clark, hospital number 1252569, gender is male, date of birth is 1952, December 6. Room number is BVC 704, and physician in charge is Dr. Gregory Sparks. And after verifying all the information, it's time for you to set up your table and the bed for on the working height, which is the waist level. But right now my table is is a little lower than the waist level, but so if you're gonna do this, make sure it's on your waist level or above to avoid contamination. And that being said, I'm gonna put my gloves on. And after I put my gloves on, I'm gonna do a pain assessment. I'm gonna ask the patient from a range of 1 to 10, 10 being the highest, how would you rate the pain? And after that, I'm gonna remove the old dressing, and I'm gonna do it by removing it one layer at a time and away from the patient's line of vision. And once you take off the dressing, you want to dispose of it. And right now I'm gonna dispose it together with my gloves. There you go. And you wanna do a wound assessment. So this wound is pretty looking pretty good. It doesn't have any drainage, and the edges of the incision wound is tightly snug together, so it's good. And after that, you want to do a hand hygiene. And once your hands are dry again, you are ready to set up the sterile field. And for your dressing tray, Make sure that it doesn't have any holes and it hasn't been opened, making sure that it's still sterile. And I'm gonna open it towards me to avoid going over it. There we go. And the first drape, I don't need it, so I'm gonna dispose it in the garbage. And the second one, I'm gonna grab it by the edge, let it unfold by itself. Make sure it's above your waistline so it stays sterile. And set it up. And once it's done, you wanna put your normal saline in the tray, and you wanna check it 3 times to make sure it's the right one. So first, 0.9% sodium chloride, normal saline. Second, 0.9% sodium chloride, normal saline. And third, 0.9% sodium chloride, normal saline. And you want to check the expiry date, make sure that it's still good. So the expiry date is tomorrow, October 7th, year 2020. And it has been opened this morning, so I'm gonna put the lid upside down here and let a little bit drip, just to make sure the tip of the bottle is still sterile. And you want to put your normal saline on the tray now, slowly, so it doesn't create a splash. There you go. And now you are ready to clean the wound edges. And I'm gonna do it using the 2x2 gauze. Dip it in the normal saline, and you wanna clean the wound in one direction and dispose. There you go. And after cleaning it with normal saline, either or you can do it with you can dry it with another gauze, or you can let it sit there and air dry. And right now I'm gonna let it sit there and air dry so I can set up more sterile materials. And you want to put gauze right beside where you incision site, so you can put the staple somewhere and count it. Make sure that everything that you take off is on there, just so no one is gonna get injured, either the patient or another nurse, just to be safe. And now I'm gonna put on my sterile gloves. But before I put it on, I'm gonna do a hand hygiene. And once my hands are dry, I'm gonna open my sterile gloves package. Grab it by the edge. And with your sterile gloves, you want to put on, or you want to don the dominant hand first. I'm right-handed, so that makes it right first. And you want to touch it inside, not the outside part, because the outside part is sterile. And remember, sterile only touches sterile. And this gloves is pretty small, so for my hands, I'm doing my best to put it on properly. And next is the non-dominant hand, and you want to do it by grabbing it from the outside. Make sure not to touch the inside. There you go. And now you are ready to take off the staples. And in the procedure, it says we can only take three staples, so I'm only gonna take off 3. Make sure that the staple remover is not touching the skin, so it stays sterile. That's the first one. Second one. And once you take off 2, you wanna clean the incision sites so it doesn't get infected. Dip it in normal saline, and again wipe it in one direction. And dispose. And after you wipe it down with normal saline, it's either you want to dry it with another gauze or let it air dry, and I want to air dry it, so I'm gonna wait for a bit. And it's time for me to put my stair strips. And with these strips, you don't need to pull them out, just so it can accommodate a wider range, because these stair strips are pretty strong, so it will hold off the skin for sure. So you don't need to stretch it and anything. Just put it on top of the incision site. There you go. And after that, you are free to take off your third staple. There you go. Give it a little shake. There you go. Put it there. And again, you want to clean the incision site to avoid infection. Dip it in the normal saline. And again, you want to do it in one direction. And dispose. And now you are ready to once it's dried, you are ready to put your third Steri strip. There you go. And after putting the last Steri strip, it's time to cover up the wound with a new dressing. And we're gonna cover it with the 4x4 gauze as ordered by the physician. Go. And then secure it in place with the tape. And once you're done putting your new dressing, you wanna document the date, the time, and your initial on the new dressing, just so that it is documented. And after that, you are done with your procedure and you are ready to dispose all your contaminated materials. Go. And for the staples that you've removed, I removed 3, so there's a 1, 2, and 3, making sure that they are all here and everyone is safe from it. And make sure to dispose it in the sharps container. There you go. And the last thing that you're gonna take off is your gloves. Make sure to take it off properly. And dispose. And now you're done with all your procedures. It's time for you to. This is the best time for you to do your patient teaching, and I'm gonna teach my patient on how to remove the old dressing and apply a new dressing. I'm gonna teach him how to clean the incision site or the wound site with normal saline, so it doesn't get infected. And lastly, to change the dressing regularly to avoid contamination. And once I'm done with that, I'm gonna make sure that my patient is comfortable and the bell is within reach of the patient. So if he needs something, he can call and someone can come and attend to him. And on my way out, I'm gonna do another hand hygiene. And that's it.